Oval foramen. An oval-shaped opening positioned posterolateral to the lateral pterygoid plate. Foramen spinosum, located just posterolateral to the oval foramen, and generally smaller and more circular. Foramen lacerum, situated medially and anteriorly adjacent to the apex of the petrous temporal bone. From this inferior perspective, it appears as an irregular gap bordered by the sphenoid, temporal, and occipital bones. The temporal bone presents several landmarks in the norma basalis. The most prominent is the mastoid process, a rounded projection located posteriorly and laterally. Anteromedial to the mastoid process lies the styloid process, a slender, pointed, bony projection. Between the styloid process and the mastoid process is the stylomastoid foramen, a small but distinct circular opening. Anterior to the styloid process, on the inferior aspect of the petrous part of the temporal bone, is the carotid canal, visible as a round opening directed anteromedially. Its internal curvature is not visible here, but the external aperture is clearly defined. Posterolateral to the carotid canal, the jugular foramen is seen as a larger, irregular opening, marking the junction between the temporal and occipital bones. The central and dominant feature of the norma basalis is the foramen magnum, a large oval opening occupying the midline of the occipital bone. Its anterior border is defined by the basioccipital region, which extends forward toward the body of the sphenoid. Its lateral borders include the occipital condyles, smooth, rounded prominences that project downward on either side of the foramen magnum. Posteriorly, the foramen is bordered by the curved squamous part of the occipital bone. Lateral to the occipital condyles lie the hypoglossal canals, situated within the occipital bone, though their exact orientation may vary slightly depending on skull position. Further posterior, right behind the condyle, is situated the condylar canal. In this view, at the most anterior part, the greater and lesser palatine foramen, as well as the inferior orbital fissure, are visible. This view is presented for better visualization of the hypoglossal canal. This video is a product of the 3D Atlas of Neurological Surgery platform.